Okay, welcome everyone. Let's begin. Welcome to the PUA webinar on the Shovavim series. In the past years, we've had a series of Shovavim on the halachos of Niddah, but tonight, Bez Hashem, it's going to be just a one-time shir on the topic of Niddah and how it specifically relates to fertility. My name is Eliezer Krohn. I have the great zchus of being rabbinic advisor for PUA America, and what we generally do, we're busy all day with. We try to help couples with their fertility journey, couples and singles with their fertilities, whether it's taras hamishpacha, whether it's halacha, whether it's medical guidance, hashgacha, emotional support, financial support. There's a lot that Klal Yisrael needs help with in the world of fertility at large. And the inyanim of Taras HaMishpacha and Inyani Kedusha is something that we focus very much on during these weeks of Shovavim. So what we're going to do tonight, with Hashem's help, is go through some of the I don't want to say basics, but some of the common questions that come up in regards to the halachos of Niddah, and specifically how they relate to fertility. We'll get more to fertility as we move along. But what I'd like to start off with is an overview of the very relevant halachos of Niddah. Now, I don't know exactly who I am talking to, and I don't see anybody here because this is a webinar. It's not like a typical Zoom. So some of you, I'm sure many of you are very learned, and a lot of the halachos that we're going to mention are halachos that you know already. And then there's going to be some more in-depth and complicated halacha that some of you perhaps will not follow, but that's okay. You'll get definitely a vast majority of what we're going to discuss. And I'll give you my email address at the end of the shir if anyone wants to follow up with questions. But let's get right to it. So it's important to know when it comes to the halachos of Niddah that there's a big difference between something that's on a deraisa level by Torah law, or something that's only forbidden midrabanan. So according to the Torah, midaraisa, once a woman sees dam, so when she gets her period, so she is in Niddah for 7 days. And whether she sees for 4 days, for 5 days, whatever is normal for her, at the end of 7 days, she's no longer a Niddah. And the Gemara and the Shulchan Aruch tell us that even though that's the case by a normal, regular flow, and it's only perhaps if she sees a certain amount and in a certain way, it's something that's called a hargasha. We're not going to get into what exactly is a hargasha, but if a woman, let's just assume she feels it, she feels the dam coming out, so then on a deraisa level, she is a Niddah. But midirabanan, the Gemara tells us that the Bnei Yisrael were hechmiru al atzman. They were extra stringent, and even if they see a tiny speck of dam in certain situations, which we'll discuss, so then she already keeps the Zayin Nikiyim. She keeps the 7 clean days. According to Torah law, she only has to keep 7 clean days if she saw at a certain time of the month and a certain amount of days. But midrabanan, it doesn't make a difference. Once she sees dam, she has to keep the 7 clean days, and right away that's a big difference between the deraisa and the derabanan, and we're going to see various differences in halacha in Hilchos Niddah, and it's going to be relevant to fertility in the difference between what is midaraisa and what is midarabanan. Now, a hargasha, as we said before, is she feels some type of sensation over in that area that she sees dam. But nowadays, they don't really, generally, a woman doesn't have a hargasha. She doesn't necessarily feel it. She won't know. But if she has her period, so then either way, she's considered a Niddah. But an important issue, the first issue we're going to discuss is the following. That there are times where a woman can have a hargasha, but she thinks really it was something else, and she can't tell. For example, let's say she does a bedika. There are certain times when she has to do a bedika, she takes a bedika cloth and she goes inside and she checks to make sure that she's clean. At the time that she does the bedika, she might really have had a hargasha at that moment, but she just thought that it was the pressure from her finger and the bedika cloth. So the halacha is that if she sees dam on that bedika cloth, we have to suspect that that really was a niddah midaraisa because she saw dam and maybe it came along with her hargasha. And again, I'm going to tell you in a moment what is the big difference, whether she's obligated midaraisa, she's a niddah midaraisa, or a niddah midarabanan. Likewise, let's say she was using the bathroom. She was being matal meraglayim, and she has a sensation over there, so she figured it's from using the bathroom. So she didn't think it was a hargasha. And then she finds some blood on the toilet paper, on the tissue paper. So wait a second, do we say, is that considered a da'iraisa and it's going to have all the stringencies? Or let's say she had tashmish together with her husband, and at that time, then she saw dam. So she might have mistaken it, and really it was a hargasha. So we're going to have to see as we go along that there's going to be times where midaraisa, she's a niddah. There are times where we suspect that she's a niddah midaraisa, and then there are times where she's only a niddah midarabanan. And when she's only a niddah midarabanan, that's called a kesem. A kesem, the literal translation of the word kesem is a stain. Fine, in English we call that as well. A woman says she's staining, but a kesem is a stain, and what basically that means is that she saw dam, but she didn't have a hargasha. She didn't have a hargasha, and she takes off her undergarments and she sees that there's some blood on it. So she didn't have a hargasha, but it was a kesem. So we're going to see. We'll start right now. The differences between the deraisa and the derabana. So number one leniency, and this is going to play a major role in the area of fertility. And that's like this. The first leniency is that a regular re'iyah, if she had a hargasha, she knew she had a hargasha, let's say in the times of the Gemara, where we take it for granted that they know when they have a hargasha. So the halacha is that even a tiny spot, even if it was a tiny spot, if it was a hargasha, we assume that that was a deraisa. However, by a kesem, so then it's only if it's the size of a gris or more. So now, literally the translation of a gris is a bean. What's relevant for us is that it's the size of a penny. A great discussion, how big exactly is a gris? A kina is that size, a lice, but how much blood could that create? We paskin that that's the size of a penny. So now, when it's less than the size of a penny, she takes off her underwear. I'm not getting into right now what color, but she takes off her underwear and she sees that there's dam, there's blood on it. So the question right away is, how big was that dam? If it was less than the size of a penny, so then even if it's red, so then we say that that's okay. However, if it was a re'iyah, so then even if she had a hargasha, so then even a tiny bit, she would be considered tmeya. Okay, so we just said a moment ago a big thing. We said that if she does a bedika, so we have to suspect that maybe she really had a hargasha. That is number one. That when it comes to a bedika, the size of the blood on the bedika cloth is not relevant, because we say that perhaps she had a hargasha at that time, and if she had a hargasha at that time, she is a niddah midaraisa, and then the size doesn't make a difference. That which we always ask, what's the size? Is the size of a penny? We look to see, is it the size of a penny? Is never going to be the case on a bedika cloth. It's only going to be on undergarments, because there it's just a kesem, and by a kesem we say that's a leniency, that it's only if it's the size of a penny or more. Now, measuring the size of a penny is not so simple, because it doesn't always come out in a perfect circle. It comes in all different shapes and sizes. So the halacha is that it's the area of 19 millimeters, which is the size of a penny, but you have to be trained in how exactly to estimate. A person can't necessarily just take a look and say, oh, looks less than a penny to me. Wait a second. You could have a red dam on one side of the underwear and then another spot somewhere else. So if they're not connected, it's considered two separate ksamim, two separate stains. And if each one is less than a penny, even though together they make more than a penny, that's okay. But let's say there's red and brown. Brown is not a problem. You have to have experience. You have to be trained. What's considered red? What's considered brown? But assuming part of it is red and part of it is brown, but the two reds are connected by the brown. So the halacha is that those two, the brown doesn't count towards the penny, but the two reds are combined together. So you have to be able to estimate this and that together. You have to be able to see, are they really connected? Sometimes there's a little bit of white from the underwear in between. In such a case, so then those don't combine. But measuring a gris is not something that necessarily a layman can do. I actually have a card of the size of a penny in all different shapes, long and skinny and different shapes, a perfect circle, of course, and a little stretched out and more stretched out, because and it's helpful to you, and it's a see-through card. It's like the size of like a credit card. I keep it in my wallet, and this way you could estimate in that way. But that's number one, the difference between a deraisa and a derabanan of a kesem, and it's very important when it comes to a bedika. A second limitation is a kesem on a beged savua, on a colored garment. The halacha is that when a person is in niddah midaraisa, it doesn't make a difference what color her undergarments are. But when it comes to a kesem, a derabanan, it's only on white undergarments. Now the poskim discuss at length what exactly does white mean. Let's say it's off-white. Let's say it's beige. Let's say it's gray. So the poskim discuss. We generally are lenient and we say that it's only if it's literally mamish white, but a woman should not take chances. During the Zayin Nikiyim, the halacha is she needs to wear white, unless she gets a special heter not to in special cases, but she needs to wear white. The rest of the month, she should specifically not be wearing white. The Ramah says that Lafikoch tilbash ha'isha bigdei tzevainim kidei lahatzila mikesem. The Ramah says it's not only allowed to, you should, it's advised, she should wear dark undergarments the rest of the month, because to avoid this way, if she has a kesem, even if it's bigger than the size of a penny, but if it's on colored undergarments, the Rabbana did not make their gzeira. And don't be silly, she shouldn't be wearing off-white and gray. She should wear black, dark blue, or something that is clearly not white. Why would she want to get into any questions? But this brings up a very, very important question. I think that the following question, in my humble opinion, is the biggest question when it comes to Hilchos Niddah, and that's the following. Let's say you have a woman, she's expecting her period any day now, so she knows it's coming. She's wearing dark undergarments. Obviously, she's not during the Zayin Nikiyim. She's coming up to her vest. She's getting her period soon, so she wears dark undergarments, and then lo and behold, her period begins, and it's coming, and it's coming, and it's coming. I'm wearing dark. So I'm wearing, the size doesn't make a difference if I'm wearing dark. So the halacha is that that's a joke. That can't be. It's impossible. Then a woman will never be a niddah. That's outrageous. She has her regular period. If she's wearing dark, that's not going to save her. If it's not considered a kesem, but it's already a re'iyah meruba. Re'iyah meruba means a regular period. A meruba means a lot. So it's more than a penny, but it's much more than a penny. That already, once you get to a Riyah Meruba, that's considered as if it doesn't make a difference if you have colored undergarments. The question is, how much is considered a Riyah Meruba? And the problem is that it doesn't say anywhere in Shulchan Aruch and the Ramah at what point is considered a Riyah Meruba, and then the color doesn't make a difference. One of my Rebbeim in Eretz Yisrael told me in the name of Rabbi Yashiv says, if it's 5 or 7 gris, so a gris is the size of a penny, let's assume, 5 or 7 gris, then already, even if she's wearing dark, she's considered a niddah. That's a little bit of a chumrah. There are those that say even less than that. Some say 3 gris. Others say it's more than that. They say some say it's the size of a $50 coin. Some say in the name of Rav Moshe Feinstein that it's the size of half of a dollar bill. When you can take a dollar bill, half of that is already considered a Riyah Meruba. My Rebbe here in America told me in the name of Rabbi Gluth, who was a big Talmud of Rav Moshe, that Rav Moshe never said that. So the jury's still out. The psak that I go with is what some poskim say, and that is that if it fills up a whole pad, that she has to change her pad. And basically that means, another way of saying that is that it's a regular period. Is this a stain, or is this the way her period begins? Now, it's not the amount of all 5 days in one day, but this is the way her period begins. If this is the way her period begins, then that's considered a Riyah Meruba. Now, if it's a regular vest, a regular period, good, so then she's considered a niddah. what gets very tricky sometimes when it comes to the area of fertility is a lot of times people have certain procedures, which we're going to talk about soon, and they have certain procedures, and then they have a lot of staining. So, oh, it's just a stain. Yeah, but it's coming from the uterus. And if it's a Rhea Meruba, if it hits that qualification, so then the fact that she's wearing colored is not going to help her. So that's a big question, and it's very uncomfortable as a Rav, because you don't like being machmer on people, especially she just had a procedure. She's going through a tough time as it is, and she had a lot of dam came out from her uterus because she had certain procedures. So now she's going to have to be a Niddah, to start all over again. So it's uncomfortable sometimes. But that's really a gauge that a person needs to know, when that there's a difference between a kesem, which is only a gris or more, only a penny or more. Then there's a Rhea Meruba, which is much more than that, and that already doesn't have that second limitation of colored undergarments. The third limitation is by a kesem is that it only applies on something that's makabel tumah. Clothing is makabel tumah. So white, that's got to be white, like we said, because dark is not a problem by a kesem, unless it's a Rhea Meruba. But if it's a kesem, dark is not a problem. But it has to be something that's makabel tumah, like clothing. So a very important question is toilet paper or tissue paper. Meaning, we said before that a woman goes to the bathroom and then she wipes. Can't imagine how many times I've been called, and other rabbanim also, that I found dam on the toilet paper, and it's definitely red, and it's more than a gris. Am I a Niddah? But the answer is, generally we paskin like Rav Moshe Feinstein in this area, that toilet paper and tissue paper is not considered makabel tumah because it's going to go in the garbage afterwards. So it doesn't have any chashivus. It's not a beged. It doesn't have any chashivus, and therefore it's not makabel tumah. And if it's just a kesem, so then we say that she's not tummy. But the problem is that, wait a second, we said before that when she goes to the bathroom, maybe that really masked a hargasha. So Rav Moshe Feinstein says the following, that usually she uses the bathroom, then she waits a few seconds, gets some toilet paper, some tissue paper, and then she wipes herself. So there was time in between the hatalas mereglayim and the wiping. So says Rav Moshe, very famous, that unless she was in a very big rush, the phone was ringing, or the kids were screaming outside of the bathroom, or the pot was on the fire, and she was in a big rush. Otherwise, so then maybe she wiped while she was urinating, and then that was really a hargasha. So then toilet paper doesn't make a difference because it's a daraisa, perhaps. Otherwise, we say that probably there was a pause, there was a break after she finished actually using the bathroom, then she wiped herself. So then we say that that's a kesem, and if it's on toilet paper that's not makabel tumah, then we say that she's safe. Similarly, a pad, we paskin, Rav Moshe paskins, is not makabel tumah because a pad is going to go in the garbage. So now again, if it's a Rhea Meruba on a pad, she's still considered tummy. But if she sees even more than a penny, even more than a gris, it's still a kesem on a pad, and therefore she's not considered a niddah because it was on a pad, and a pad is not makabel tumah. Fine. This is very relevant to different birth controls. Now, this is the first thing that we're really going to get into when it comes to fertility. Women have birth control. They don't want to get pregnant for whatever reason at that time. Certainly, a person needs to ask a shaila. A person can't just decide by themselves. I decide I want to go on birth control for a certain amount of time. They need to speak to their rav that knows their situation and get a heter for using birth control. There's various types of birth control. One is hormonal birth control, which is that she could take pills, and the woman needs to take a certain pill every single day. A lot of them you have to take exactly at the same time every single day. So some women set an alarm on their clock or on their phone. A lot of women don't like to have to take pills every single time at the same time every day, because you're going to forget and she's busy. So they have what's called an IUD. An IUD stands for an intrauterine device, and it's a device. It looks like the shape of a T, but it's put into the uterus and it stays there. And there's really two types of an IUD. An IUD, one type is the hormonal IUD. It's called the Mirena, and there's other companies as well. A hormonal IUD, and it could stay in there for like 3 to 6 years. and it goes consistently, automatically. It gives off certain hormones similar to the pills. The problem is, and it's great, it works great. The problem is that when you're messing around with the hormones in the body, there could be spotting. There definitely could be spotting for several months in the beginning until the body gets used to the hormones that the pill is giving or the hormonal IUD. And the great question is that bleeding that she has, right? It's a hormonal IUD. It's supposed to prevent her from getting her period. It's very annoying. Here she's still spotting she's getting a period. Is she a Niddah from any spotting on a hormonal IUD or for pills of hormones for that matter? The general understanding a person needs to ask a shaila is that when it's hormonal, it's coming from the uterus. It is coming from the uterus, so that will be, and it's part of the hormones. Yes, the hormones are not acting normal. It's being all messed up and out of whack. But the fact of the matter is that it's a period coming from the makar, from the uterus, from the endometrial line. If that's the case, she would be considered a niddah. Now wait a second. But it's a kesem. It's not any worse than any other time. So if she has a full huge flow of a Rhea Meruba on the IUD, a Rhea Meruba, it doesn't make a difference if she's wearing color on the garments. It's a Rhea Meruba. But if it's not a Rhea Meruba and she's just having, annoying spotting the first few months, so I've been asked that so many times, you got to find out, is it a kesem or is it a Rhea Meruba? If it's just a kesem, so she's wearing dark, you're sure she's wearing dark. So even if it's more than a penny, it's not a problem. One thing that's important to mention, perhaps I should have mentioned this before. A lot of times, the Paiskim tell us, and I tell this to women all the time, that if she's not obligated to look, she shouldn't look. There's no reason to look. During the Zayin Akiyim, maybe you're encouraged to look. But other than the Zayin Akiyim, there's no reason to look. Whenever we were talking before about wiping, there's no reason to look. And when people ask me a shaila, I try not to interrupt them, and I try not to tell them what they did wrong. You ask me a shaila, I'll tell you what the halacha is if I know the halacha. But I only twice, 2 situations do I say when they finish, maybe, or maybe even I interrupt if I can't control myself, that you shouldn't have done that. So number one is this: whenever people tell me that, oh, I wiped and I looked, then I say you shouldn't have looked. There's no reason to look. Just flush, and don't even look. The other time that I tell them is when they cut an onion with a fleshik knife or a milchik knife. Onions should be cut with a parav knife, because you think of putting it in this frying pan with a spatula, you can make mistakes. At least start off using a parav knife. You should own a parav knife to cut onions. Those are the 2 times that I tell people you shouldn't have done that. But over here, by a hormonal IUD or the pill, so you have to ask a shaila, but it's very possible that really would be considered niddah. But again, it's not. But it's a kesem. It is a kesem after all. The other type of IUD that people use, that women use for birth control, is a copper IUD. Now, a copper IUD can also last for many, many years, depends which type. And it's called the Paragard. And the way it works is that the copper kills the sperm as it comes in, and it makes it that it's not going to conceive, that it's not going to end up in a pregnancy. If a person does get pregnant, it could be very dangerous. So the person has to go to the doctor and take it out immediately. It's not recommended for the woman herself to take it out, but that's a copper IUD. And it's not supposed to mess around with the cycle because there's no hormones. She gets a period every month, which is one reason why people don't like the copper IUD. I might as well not get my period to make it much easier. But the copper IUD definitely can cause spotting as well, even though it doesn't play around with the hormones. But the reason is the following: that the way Hashem made the body is that the body naturally tries to reject something that's a foreign substance. That's the miracle of that. The body accepts the sperm to make an embryo and to make a fetus. It's mamish a miracle. But anything that's a foreign substance, the body tries to reject. So here you got this copper IUD that's put in, and the body tries to reject it. And the uterus contracts and opens and closes. So maybe that's considered now a natural part from a natural cycle, a natural set of events from her uterus, and maybe that would be considered a regular period, and that would be considered a kesem, and that would be considered a niddah if it's a certain amount. Or do you say that no, that's considered dam maka, it's from a wound, it's not, maybe it was punctured. So that's a great discussion in the Paiskim, and it's really hard to say if there's a clear halacha on this. You'll find Paiskim that say very strongly one way. You'll find some Paiskim that say very strongly on a different way. But certainly a person needs to ask a shaila in their situation, whether it's considered niddah. A lot of factors to be taken into consideration when on the hormonal IUD or on the copper IUD. Another discussion I wanted to get into now, it's regards to Hilchos Niddah, and it's also very, very relevant when it comes to fertility. And that is, we said many times, and you all know this, that when a person has when a person's in Niddah, it has to be that you have the seven clean days. But before the 7 clean days, you have to have a 5-day wait. We'll get to the 5 and the 4 day, but it has to be a 5-day wait. So now, where does that 5-day wait come from? So the Gemara says like this. The Gemara says that that when a husband and a wife, when they have tashmish, so the zera goes inside the woman. For 72 hours, the Gemara says, she could be what's called piletes shichva zera. That zera could go back out of her body. And the halacha is that can make her tamei. The Gemara discusses why. The Mefarshim discuss why that's the case. But if she's piletes shichva zera, so then she becomes tamei. And if it's during the zayin nikiyim, that makes her start over the zayin nikiyim. So that's 3 days. Now the halacha is that you need, if let's say a husband and a wife are together, they have tashmish 11 o'clock at night. So that ruins 4 days, not just 3 days, because you need a whole day to be clean. For the zayin nikiyim, you need an entire day from shkia to shkia, from sunset to sunset. So if they're together 11 o'clock at night, maybe she was paleta shichva zera at 11:01, and then right afterwards she became a niddah. So that takes us till Monday night, 11 o'clock, Tuesday night, Wednesday night. So Wednesday night, 11 o'clock, that messes up the whole Thursday already. So now she's already Monday, Tuesday, Wednesday, Thursday. That's 4 days that she has to wait. She can't do what's called the hefsek tara to make sure that she's clean before she starts the 7 clean days. She has to wait 4 days. The Rama says that we add a fifth day that she has to wait from her period before she's able to start the zayin nikiyim, the 7 clean days. That 5th day, says the Rama, is because perhaps she got her period during the time of Bein Hashmashos, and Bein Hashmashos is after Shkia, but before it says Sakachavim, which means that we're not positive, is it day or night? Maybe she got her period right at that moment, and she thinks, my period started on Sunday. Now, wait a second. The truth is that really it started on Monday. So she's going to make a mistake and start counting day number 1 from Sunday, but really day number 1 is Monday. So we just always tell her, you always have to have a 5th day. So she has a period on a Tuesday morning, on a Wednesday afternoon, on a Friday afternoon. Doesn't make a difference. You can't just simply do a hefsek tara when you stop bleeding. You have to have 5 days. No matter what, you have to 5 days, even if she stops bleeding after 3 days, after 4 days. Now, the truth is that the Rama is the one that added the 5th day. The Shulchan Aruch, the Sfardim go to Shulchan Aruch. Sfardim always do 4 days and 7, not 5 and 7. They do 4 and 7. Today I was on the phone with a woman and she was asking me a question that maybe she doesn't have to wait 5 days. And I told her that no, she does have to wait 5 days before she's able to do the zayin nikiyim. So I said, no, I'm sorry, that's the halacha. You have to do 5 and 7. And she said, no, but I'm Sfardi, so I do 4 and 7. I said, okay, fine, 100%. Then you do 4 and 7, but at least you need the 4 and 7. In her situation, she for sure wasn't going to be able to do hefsek tara anyways on day 4 because she had a hysteroscopy yesterday. She was explaining to me. So, and then today she's expecting her period. So, anyways, that was going to be the situation. But that's for the Ashkenazim. It's 5 and 7, and for the Sfardim, it's 4 and 7. This is very relevant to the following scenario of infertility. There's something that's called, and I don't like this name, but I'm going to say it anyways because that's just what people call it. What's called halachic infertility. What is halachic infertility? It makes it sound as if like there's something wrong with the halacha. There's nothing wrong with the halacha. This is the way Hashem wanted it, and that's the way Chazal made it. But that means the following. You know that in order for a woman to conceive and get pregnant, she has to be ovulating at that time. So when a woman has, let's say, a cycle of 28 days. So generally, a woman ovulates 14 days before her next period. So if she's going to have a period of 27, 28, 29 days, a cycle of those amount of days, so she'll be ovulating on day 13, 14, 15. So if you do the math, she'll be home from the mikvah already at that point, because she went to the mikvah on night number 12, 5 and 7. Even if she wasn't successful in getting a hefsek tahara on day number 5, she was only able to do it on day number 6. So 6 and 7, so she goes to the mikvah on night 13, but she's able to be together with her husband when she's ovulating 13, 14, or 15. However, a woman who has a short cycle, she has a cycle of, let's say, only 25 days. So when is she ovulating? She might be ovulating on day number 11. So wait a second, but she doesn't go to the mikvah until day number 12. So she can't be together with her husband until after she ovulates. So there is a little bit of a window of a time after ovulation of 12, 24, 36 hours that she can still conceive if she's together with her husband, but sometimes they miss that window, and it's a much smaller window. So the question is, what do you do in such a case? So many times we at PUA have been called that my fertility is fine, the eggs are fine, the sperm is fine, but I'm not getting to the mikveh in time. I have short cycles. What can I do to get to the mikveh earlier and be able to get and be together with my husband at the time when I'm ovulating? So the halacha is, it's based on a shla. Rav Moshe Feinstein says this, and many Chazon Ish and many other poskim, that we would allow even an Ashkenazi woman to do 4 and 7 instead of 5 and 7, to do 4 and 7. And sometimes that's the solution. You're just missing it by one day, and you could do 4 and 7. Now, a lot of times women tell me, I can't do 4 and 7. I'm not going to be able to get a clean hefsek tahara on day number 4. I bleed for 5 days. So if that's the case, so then that's not a solution. But I tell women all the time that you think that you bleed for 5 days. A lot of women, they really only bleed for 3 or 4. And then at the end, there's like some residual blood and some other things that come out. And you take that to a Rav and you check the color, you might be pleasantly surprised that that's really not considered red. You think that that's red and you just assume that it's red because I'm finishing up my period. But really it's just brown and it's not a problem. So you take it to a Rav and you might be surprised. This was really a good hefsek tahara. So it's worth it. Sometimes it's a schlep to go to the Rav and then you send the husband, the wife. It's embarrassing, but it's kedai. It's worth it to check it out. You might be able to do 4 and 7, even though you think you're not going to be able to. And sometimes the place can discuss, maybe a woman could do 3 and 7 if that's physically possible. I'm dealing with a woman now who tells me that she can do 3 and 7. She's not Sfardi, but she can do 3 and 7. And there are places that let that if the husband and wife did not have tashmish right before she had a period, because then really the 72 hours is not so much of a concern if they know that they weren't together. Person has to ask a shayla before they do it. Even a Sfardi has to ask a shayla in such a case. But that is like the olive bays when it comes to missing ovulation, to try to do 4 and 7. If that's not possible, so there are certain hormones that the doctor could prescribe, has estrogen, progesterone. There are hormones the pills that are called Clomid and Letrozole that can push off the ovulation. Sometimes just by a couple of days, that's all it takes to push it off. And doesn't always happen the first cycle. Sometimes a woman needs to be on Clomid or Letrozole for 3 or 4 months before it's successful. And sometimes even that is not successful. So then you have to go start searching for other solutions and other ideas of how you could catch the ovulation and get to the mikveh in time, or maybe perhaps to do other procedures, whether it's an IUI or an IVF, to do it, which many poskim hold is allowed to be done even during the times of Niddah. So you're doing it at the time of ovulation, even during the time of Niddah. But that's already, out of the realm of the halachos of Niddah. But that is something that is very relevant to the halachos of the 4 and 7, and as opposed to the 5 and 7. Now, I want to just discuss, before we finish, a few procedures, perhaps, and a few issues that come up when it comes to fertility that is very relevant to the halachos of Niddah. The order of what I'm about to talk about is not so relevant, but I'll just go in any order, and that is like this. There are many women that have fibroids in their uterus, or they have polyps in their uterus. and those need many times to be removed. Now, the fibroids in the uterus, it's not really so clear why these things happen, but it is pretty common. It's more than 200,000 cases per year in the US of women that have fibroids in the uterus. And it's all just messes up the hormones. A lot of times it's not the fibroids themselves that are bleeding. It's the uterus, it's the regular endometrial lining, but the hormones are out of whack because of the fibroids, perhaps because of the polyps. There's heavy bleeding, prolonged periods. Sometimes it comes with pelvic pain or in the lower abdomen over there, and it's very annoying. And sometimes it doesn't have any symptoms. They won't even realize necessarily that they have fibroids. So the treatments are either to take some medication, some hormones, or to remove them, to have the fibroids removed. And that's a shaila in Hilchos Niddah. When the fibroids are removed, sometimes the fibroids are in the uterus, sometimes the fibroids are outside of the uterus. When a woman has fibroids removed, she's going to bleed. Chances are she's going to bleed. And where's the blood coming from? The blood is coming from inside the uterus. But wait a second, it's not really from my endometrial lining. And it wasn't my regular period. The only reason why it's bleeding is because the doctor went in to the uterus and poked the endometrial lining to get rid of the fibroids, to get rid of the polyps. I spoke to a woman today who said that she had polyps removed, and we were discussing the halachos of Niddah, and she had other questions as well. And a person needs to ask a shaila, because there are poskim that say that's considered a Niddah, because once the dam comes out from the uterus, we don't know where it's coming from. We have to assume that it came from the endometrial lining, that maybe there's blood from the endometrial lining as well. And others say no. The doctor went in with his instruments, and he went in and he poked and he hurt and he took it away from the endometrial lining. That's considered dam maka, and that's dam maka, and that's not considered a Niddah. A person certainly needs to ask a shaila to their rav. Sometimes some poskim say that it depends. If there was a lot of bleeding, then she is a Niddah. If it was not a lot, then it's considered a dam maka. Interesting type of compromise. Sounds nice, although I don't really understand the logic behind it. Is it dam maka or is it not dam maka? So I don't really understand that fully. But that's number one. The fibroids in uterus, that's something that can cause infertility, because again, the hormones are out of whack. So, and anyways, even without a problem of infertility, you have other symptoms that are very annoying for a frum couple that makes them, hard to get out of Niddah. In general, there are times where a woman has a maka, a woman has a wound in that area. Now, the wound is not in the uterus. The wound is, let's say, on the walls or by the cervix. Now, she tries to do a hefsek tara on day number 5. It's not clean. The hefsek tara has to be totally clean because the size doesn't make a difference. And clean, I mean clean from red. If it's brown or yellow, it's okay. But she sees it's red. And it's painful when she does the bedika, when she tries to do the hefsek tara. So chances are that that's really a maka. That's really a wound. Now, wait a second. You can't just say, oh, it hurt me when I did the bedika, so it's probably just a wound. Okay, the hefsek tara is fine. It's not. The hefsek tara is red on the bedika cloth. So what does she have to do? Chances are she has to go to a baideket, she has to go to a nurse, and I live in Passaic. So there is a baideket here in Passaic. I've spoken to her countless times about women that I sent to her, and she says, I'm looking and I see that there's a maka, and the uterus is not bleeding, but there's a maka that's moitzi dam, and it's bleeding on the cervix, and I say, okay, thank you for letting me know. And then I paskin that she's not considered a Niddah. Sometimes the baidekas does the hefsek tara for the woman. She takes the bedika cloth and she avoids the wound on the cervix, and she does the bedika everywhere else. And she sees that it's not bleeding from the uterus. This is relevant also to what we said before. We said that a woman tries to do a bedika on day number 4 because she wants to catch the ovulation. But it's very difficult sometimes to do a hefsek tara on day number 4. So, but she tries. But then she tries again on day number 5. If she does it again and again and again, it's very sensitive over there. She herself could cause a maka. So before a woman tries, even if they ask a shayla and they're told they're allowed to, before they try to do 4 and 7, she got to be careful. If it's not going to be successful, it's not worth it to try. You got to try something. You got to try a different solution. It's not worth it to try because you could end up just causing a maka. That's important for communities to have a bedekes. We at Pua right now are working together with a doctor to train more bedekeses. I don't know if that's the plural of bedekes, but that communities should have more of them. I spoke to a woman a few weeks ago, that she said she suspected that she had a makkah. It was painful, and she couldn't get a clean hefsek tahara. And I said, "Do you have a bedekas in your community?" And she said, "No." I said, "Where do you live?" She told me where she lives, and she says, "There is no bedekas over here, but there's a firm OBGYN that it's in the neighborhood. Maybe I could go to her." So I discussed that with her. If you could rely on a firm OBGYN just to take a look, they're not really trained in looking for makkahs on the cervix. So it's important for communities to have a bedekas, and we're trying. We're working on it to get women to sign up. Any man over here, that any of you listening that knows, perhaps your wives, perhaps your mothers that are, especially if they're a little bit in the medical field and they'd be willing to be a bedekas. It's put through a training course from a great doctor, and a firm doctor that knows the connection between the halacha and the medicine and the mitzias. So just reach out to us, and it's a great chesed. You're looking to do chesed for the community. If a woman could do that, it's a great chesed that a lot of communities need. There's another condition that's called endometriosis. Endometriosis is that the tissue that normally lines the uterus grows outside the uterus. Sometimes it grows on the ovaries or on the fallopian tubes or on the intestines, and it's very painful. First of all, her cycles are a lot of times off, irregular, and it's very painful, especially during her period. There's different stages. There's minimal, mild, moderate, severe, but endometriosis is something that we deal with. Unfortunately, too often. Is even more than 200,000 cases a year in the U.S. and they test for it. Sometimes I just spoke to a woman recently that she was telling me about her daughter. Her daughter is single, but telling me about her daughter that she has this and she has that, and she described to me certain things. And I said, "Does your daughter have endometriosis?" And she's like, "I don't know." I said, "I really think you should get it tested out. I think your daughter should go to an OBGYN. It's not so comfortable for a single girl to go to OBGYN. She's not used to that." And I said, "I really think you should, get it checked out. Sometimes it's just an ultrasound, sometimes it's an MRI, but you really should." I told her she really should check it out. She actually did not get back to me yet, so I'm not sure what ended up happening. It was already a few weeks ago. I should probably follow up with her, but that's something that is relevant to the halachos of Niddah, because she could have irregular periods. And any rabbanim that are listening or watching, that it's important to know, if you are dealing with a woman who just constantly is coming to you, and not just with a makkah, but the Bedeka says there's no makkah. She's just totally irregular periods, and it's just out of whack. So then it might be, and especially if it's painful, so that really could be endometriosis. And it doesn't have to affect fertility, but it certainly can. It definitely can affect fertility, and you could Google online different ways how to help it naturally, but a lot of times it needs some type of treatment, again, either naturally or hormones, but sometimes it needs a surgery. Sometimes it needs a surgery, and if it's a woman that doesn't want to have kids anymore, she could, do a hysterectomy and remove the uterus completely. Sometimes, but that's something that is something that we deal with, unfortunately, very often. There is another condition that is called PCOS. PCOS it stands for polycystic ovarian syndrome, and it's a hormonal imbalance. And naturally, the way it works is that when a woman ovulates every month, she ovulates one egg, and she hopes perhaps that that's going to result in a child, in a pregnancy. PCOS, and one way of describing PCOS is that sometimes women don't ovulate at all. Sometimes they ovulate way too many eggs, and it's like a log jam, a traffic jam, too many eggs, and it's just not good quality eggs. And sometimes it results in not getting their periods for 60 days or even more than that. There are some females that they don't get their period for 100 days, and they could only get their period if they take certain hormones. And that is very relevant to the halachos of Niddah, because a lot of times the periods are irregular. I'm not getting my period. I'm not in Niddah, for months. So chances are she has PCOS. And it's a great discussion, a great question. If a girl knows she has PCOS, does she need to say that by shidduchim on the first date, before she gets engaged? Does she have to say that or not? Pua's policy is that since a woman with PCOS can get pregnant naturally. So Pua's policy is that she does not need to say by Shidduchim. All the Rabbanim that I've spoken to in the fertility field feel the same way, that PCOS is just another way of saying irregular periods. 10% of females have PCOS. Some people don't even realize that they have PCOS, and a person could get pregnant naturally, and because of that, they don't need to say. But that is another issue that comes up when it comes to fertility. There's a procedure that's called an HSG. HSG is, it's not even relevant what it stands for. I have it written down. Hysterosalpingography, whatever. Nobody calls it that. It's called an HSG. What it is to check if the fallopian tubes are blocked or misshaped. Not a lot of times, but sometimes it could happen that you have the ovaries on the left and the right, and then the uterus is in the middle, a little bit lower down. And there's fallopian tubes that are connecting the ovaries. It sends out an egg, and the egg goes through the tube into the uterus, and hopefully it'll connect with one of the sperm and will create an embryo and create a fetus and create a child. So if the fallopian tube is blocked, an egg can't get through. And chas v'shalom, if both fallopian tubes are blocked. So how do you check? A woman's not getting pregnant. Well, what's going on? Everything seems to be fine. So she does an HSG. What they do is that they shoot a certain dye into the uterus, and that uterus travels, and they take an X-ray, and they could see that dye, and they see the uterus and the fallopian tubes. And if the dye goes straight through the fallopian tubes, that means it's not blocked. But if it gets stuck, so then that means that it is blocked, and something's wrong. So that might be an indication that the fallopian tubes are blocked, and it's possible to unblock them. Now, obviously, when do you do an HSG? You don't do an HSG after she ovulates, because chas v'shalom, maybe she's pregnant. So if she's pregnant, you don't want to start putting dyes in there and messing around with the uterus. So it's done before ovulation, but after her period. Now, it's not done during her period because there's too much blood over there. It's going on. The endometrial lining is shedding right now. So when do they do it? After her period is over, before ovulation. What do we call that? Zayin. So the question is does an HSG make a woman a Niddah? And once again, this is a great discussion in the Paiskim. A woman certainly needs to ask a Shaila if she has an HSG, because generally the HSG will be done during the Zayin. Does it make her start the Zayin all over from the beginning? They went inside the uterus, something went inside the uterus, the dye went inside the uterus. So if she's bleeding, she's got to ask. Sometimes you could ask the doctor, and the doctor will say, the bleeding is not from the uterus. I know for a fact it's not from the uterus. I see it. It's from the walls. It's from the cervix. Okay, so then you have to know, can you trust the doctor? Does it make a difference if he's Jewish or not, frum or not? These are all complicated questions that do we say, can we rely on the doctor? But a person needs to ask a Shaila when it comes to an HSG, which touches upon another sugya, a great sugya, which is called or not, which means that the Gemara discusses, if let's say the uterus opens up and something comes out, the Gemara is discussing a miscarriage, a nafel that comes out. So if there's bleeding, it came from the uterus, so she's a Niddah. But let's say there's no bleeding, but the uterus opened up. So do we say that once the uterus opened up, there must have been blood? There must have been blood. We didn't see it, but there must have been blood. And then she's considered a Niddah because it came from the uterus. So a machlokas, one opinion says yes, one opinion says no. A machlokas, how we paskin? Do we paskin like the opinion yes? Do we paskin like the opinion no? And even if you paskin like the opinion that no, it's impossible, it has to be that there was blood, and therefore we're going to say she's a Niddah. Let's say nothing came out from the inside. Let's say it's that a doctor opened it up from the outside. Do we say that? The Niddah Yehuda discusses that. So that is a machlokas. So it's a machlokas upon a machlokas. And the place can say that even if you say that if it's opened up from the outside or the inside, certainly the inside, that could be that you for sure considered a Niddah, but does it have to be a certain size? So we say, generally we pass like Rav Moshe Feinstein, that over here as well, it's 19 millimeters. And on most instruments that the doctors use are less than 19 millimeters. So then you don't even have a problem of psichas hakever, of the kever opening up. Even if you assume, even from the outside, and you assume that yes, it has to be that there was blood, but that's only if it opens up 19 millimeters, and generally it does not open up 19 millimeters. But that, the HSG and a lot of other procedures done in the fertility world, just a regular hysteroscopy. A hysteroscopy, I spoke to a woman today about a hysteroscopy that, they go in and they check out what's going on in the uterus. They check the shape of the uterus, they check the lining of the uterus, they check what's going on, they check if there's any scars, polyps in the uterus. So that's psichas hakever, that's opening up from the outside. So generally we're able to be lenient because we say that the instruments are very small. We'll just mention one other procedure that is done. I was on the phone today for over a half hour with a woman who is Baruch Hashem pregnant, but she's pregnant with multiples. And the doctor wants to do what's called a CVS to check out the placenta, a membrane, surrounding the fetus is called the chorionic. So it's called the chorionic villus sampling. So you don't just check the placenta, you check the fetus itself, and it's risky. The doctor wants to do it, but it is risky and it's dangerous perhaps for the fetuses. It's done between 11 and 14 weeks of pregnancy. And generally, there's really no reason to do it unless a couple suspects that there's a genetic problem, which is why I was asking this woman, why does the doctor want to do a CVS? Okay, I realize it's multiples, but we don't suspect anything is wrong with the fetuses. So why would we do a CVS? And I suspected that they were looking for excuses to do an abortion because the doctors don't like multiples, so they're looking for trouble, they're looking for problems, and I don't even know if I trust the doctor. And I said, maybe he's going to say, yeah, there's something wrong, and the couple has no idea. There's something wrong with one of them. We should do fetal reduction, which is another way of saying an abortion. So we're on the phone for a long, long time, and I actually discussed it with one of the top rabbanim of Pua in Eretz Yisrael. So by a CVS, once again, the bleeding might be from the placenta, but maybe it's from the uterine lining. So it's hard. It's hard to be not there when a woman bleeds. Now, usually when a woman is pregnant, she's not a Niddah, so she's expecting not to be a Niddah for a long, long time. But then she has this procedure. So if she bleeds, you have to know, where is she bleeding from? Do we rely on the doctor? A person needs to ask a shayla. But all these types of situations, it's not just simple. Again, even Lakula, you can say, I was bleeding, so for sure I'm a Niddah. What a shame. But it's not necessarily. It depends where the bleeding came from. If the bleeding came only from the uterus, does that make it that now you're a Niddah? If it's from the vaginal walls or from the cervix, so then it's not automatically considered a Niddah. There's so much more to talk about when it comes to fertility, but I really wasn't supposed to be focusing only on fertility. It's supposed to be focusing fertility and how that relates to Hilchos Niddah. And that's why I didn't really talk about the sugya of vestas. I didn't talk about the sugya of harchakas. I spoke about that in previous years for the Shovavim Shiurim for Pua, but this year I didn't get into it. I tried to touch upon Niddah and fertility and situations that touch upon really both of them. And it's a lot. As a rabbinic advisor, rabbinic counselor for Pua, it's not just simply knowing the halacha. It's talking to couples, trying to calm them, to guide them together in halacha and medicine. And I don't claim to know the answers to everything, but we have connections to top rabbanim, to top doctors. And when it's a question that needs top rabbanim, we go to them. And when it's a question that needs the top doctors, we go to them. And we have rabbanim and people that are so knowledgeable. And it's a great zchus. It's a great zchus to be able to help couples, to help singles. Fertility preservation is something that we do all the time, but it's not really so relevant to Hilchos Niddah, because most young ladies that are doing fertility preservation are single, although it is relevant to whether it breaks the psulim or not. I've been asked that many times. Is that a problem for the ksuba later? That's not really Hilchos Niddah, it's Hilchos ksuba technically, but anyone that that is perhaps struggling in fertility, give them our number. You can go to the Pua website. Our numbers are there, 718-336-0603. I'll give you my Pua email address. It's Rabbi Krohn, RABBIKROHN, at puafertility.org, PUAH fertility.org. Reach out to me if you have any questions about the shiur that we just gave, or questions in fertility, but questions about fertility, and or anybody that you know that wants to reach out. It's our schus to be able to try to help couples, and Baruch Hashem, there's nothing more special than getting a phone call. I'm pregnant. A phone call that I had a baby, and they send us pictures, and I'm a male, Baruch Hashem, and I've had the great schus of doing brisim on babies that I've helped from beginning to end. Not necessarily that I thought of things that no other doctor could have thought of, of course not, but I guided them and helped them in the halacha, sent them in the right path with HaKadosh Baruch Hu's help, and those brisim were so special. Every bris is special, but those brisim were so extra special, and it's a schus to be able to help Klal Yisrael. Reach out to us whenever you want, whenever you need. And in these weeks of Shovavim, we should learn the sugyas of Taras HaMishpacha in Yoni Kedusha, and we should be able to share only on simchas together, and until Mashiach comes, and then Mashiach will come, B'meher B'yameinu, and we'll see no more tsaras, no more sorrow. We'll only have simchas together in the third Beis HaMikdash. Thank you for joining, everyone.